Okay, so at this time, I would like to welcome everyone who has joined. My name is Catherine Oakes, and I'll be the moderator for today's event. The speakers reviewed all of the questions and comments that came in during the registration and have all adjusted their presentations to incorporate the answers to your questions and address your comments. We will be taking live questions throughout today's event, and we will answer as many of those as possible at the end in the panel discussion. So without further ado, we're going to get into our first presenter. It's my pleasure to introduce you now to our keynote speaker, Ms. Ann Hayes, who will provide an overview of PICS, including the benefits and requirements for PICS membership and participation. Ann has been working with Ireland's Health Products Regulatory Authority, HPRA, for 21 years. As HPRA's inspection manager, Ann has responsibility for all inspection programs relating to good manufacturing practice, medical device auditing, good clinical practice, good pharmacovigilance practice, and good practice in relation to blood, tissues and cells, and organs for transplantation. Ann has been a PICS committee member since 2005 and was the chair of the PICS subcommittee on compliance from 2011 through 2019. She was elected PICS deputy chairperson for 2018 through 2019 and became the PICS chairperson effective January 2020. Before joining the HPRA, Ann worked in the pharmaceutical industry for 5 years as a QC supervisor and as a qualified person. So it is my pleasure and privilege, and without further ado, to introduce and welcome Ms. Ann Hayes. Ann, you have the floor.
Thank you very much, Catherine. It's an honor to be here and to see so much interest in PICS, and it's a great pleasure to be able to provide this information and overview on the organization and the benefits that we see for membership and being part of what we call the family of PICS. So in my presentation, I'm going to speak about who PICS is, why I think an agency should apply to become a member of PICS. I'll talk about the routes for membership. So the first route is the pre-accession, and I'll speak about when an agency might consider applying via this route. The full membership option is the second route, and I'll speak about when that should be applied for directly. I want to give an overview of the benefits of applying to PICS, and I'll speak about 4 of those in particular. And then I'll finish up with providing details for the PICS Secretariat and their contacts if you want to follow up with looking for information from them. So looking then at who we are in PICS. So the Pharmaceutical Inspection Cooperation Scheme is a legally non-binding informal arrangement between regulatory authorities in the field of GMP for medicinal products for both human and veterinary use. PICS aims to harmonise inspection procedures worldwide by developing common standards and by providing training opportunities for inspectors. And this is reflected in the PICS mission that we have here on this slide. When we look at our current membership in PICS, we have members from every continent except Antarctica. We have currently 53 participating authorities within PICS, and they're coloured in the dark blue on the map. And we have 4 applications in process at the moment from the regulatory authorities in Armenia, Brazil, Bulgaria, and Saudi Arabia. When we look at the pre-accession map, apologies, we see that there are Currently 3 pre-accession members from Bangladesh, Jordan and Pakistan, and we have former accession regulatory authorities from Belarus, Chile, Kazakhstan, Russia and Uganda. We have 2 members who did go through the pre-accession route first, from Mexico and Armenia, and they completed their pre-accession process and then subsequently applied for membership. I want to speak a little bit about the history of PICS because it's an interesting background that we have. PIC, which is the Pharmaceutical Inspection Convention, was established in 1970 and it came into force in 1971. PIC was a formal convention made up of 10 members of EFTA. Subsequent member countries joined in 1993 or prior to 1993. And then the PICS scheme was started in 1995. And both operate together in parallel, and we refer to them as PICS, the Pharmaceutical Inspection Cooperation Scheme. In the photograph here, we can see the member countries who attended the 40th anniversary in 2011 in Geneva when we celebrated that milestone. A little bit more about the background and why we have the 2 elements. So when the organization, the convention was established, it operated more or less as a mutual recognition between members. And then when the EU Maastricht Treaty came into force in the 1990s, it was identified that no new members could join PICS convention because the European Commission had the authority in Europe only to sign treaties and conventions. So consequently, the PICS scheme was formed in November of 1995. Inspectorates and industry favoured maintaining the principles of PIC and didn't feel that there was a benefit in abandoning it at that stage. In the next slide, we have information here about the original goals of the PIC organisation and how they map across to the goals of PICS. And there are many in common, such as the development and promotion of standards, the training of GMP inspectors, facilitating cooperation between authorities, and also the assessment of GMP inspectorates as part of membership. The one element that is different is the mutual confidence that was there in the PIC convention, but it doesn't translate over into the PICS scheme. We develop a roadmap within PICS to identify our strategic direction, and the roadmap for 2018 and 2020, which was adopted in 2017, focuses on 3 goals primarily for PICS, and they're around the training of inspectors, information sharing between authorities, and strengthening of the PICS organisation. I'm very pleased to announce that the roadmap for 2021 to 2026 has just started development, and we aim to complete it by our 50th anniversary next year in June. I thought it might be interesting to speak about some recent developments in PICS to give you a flavour of where the roadmap has taken us. A really significant milestone for PICS has been the development of the Inspectorate Academy. So I'm starting at the bottom of the slide here in 2014. So the PICS Inspectorate Academy is something I'll speak about in a later slide, but it's a fundamental part of our goals and ambitions for inspector training. We've had a very busy period for the accession of new members to PICS, and in 2016 and 18, new members joined the organisation. In 2018, a new guidance on inspection reliance came into force within PICS, and it's an important framework that we are promoting within the organisation for members to use information from other authorities to make decisions on overseas inspections. In 2019, we had our last committee meeting and seminar in Japan, and we updated the rules of the organisation, the PICS scheme. And then in January of this year, we had the accession of the Italy VET agency to PICS. So in considering the question of why should an agency apply to PICS, I've identified some high-level points here that I think underlie or answer this question. To strengthen the inspectorate and the standards employed by that inspectorate would be one of the most important and key goals. It also facilitates gaining access to basic and advanced training for inspectors, GMP inspectors in particular. It allows the authority to participate in the development of ways to inspect and supervise the industry, in particular by providing a GMP standard that is recognised by all of the 53 authorities and is equivalent amongst the members of PICS. It allows an agency to implement and improve its quality system within the inspectorate. And a very important aspect within PICS is the opportunities to cooperate and network and influence within a large international organisation. PICS is open to any authority that has comparable GMP inspection systems. We have a pre-accession procedure that is different to the membership application process, and I want to explain how in this slide. An agency should use this route if it's unsure of whether it meets the PICS requirements, and also if it doesn't apply the PICS GMP guide or a guide that's equivalent. If they're not that familiar with PICS and haven't participated in training activities, we would recommend using this route. And if they have not yet introduced a quality system as per the PICS recommendation, we would strongly recommend that an agency or authority would consider pre-accession route in the first instance. It isn't mandatory. A membership application can be lodged, but if any of these elements are in place in the authority, we would be recommending that they consider pre-accession in the first instance. And I'll explain what pre-accession is in this slide. So this was a process that was introduced in 2011 as a pre-membership step. And an application is submitted by the authority concerned through the Secretariat, and the committee appoints a rapporteur. The membership assessment is explained by the rapporteur, and the tools that we use in a membership assessment are also explained. The authority carries out a self-evaluation against these and liaises and works with the rapporteur if they have any questions or don't understand elements that are being looked at. At the end of the process, the rapporteur will send a summary report to the PICS committee outlining how the process was run and what the main areas or gaps identified by the applicant were considered to be, and will also make a recommendation to the committee and to the pre-accession applicant about a future membership application. For this procedure, a 2-year time frame applies. So it's a quick conclusion. And during that time, the applicants can attend the PICS committee meetings and PICS training events. And they are very much encouraged to attend the committee meetings, to engage with the rapporteur and speak with them about their assessment. When we look at the PICS membership route, I've outlined here when an agency should consider applying for this route. We've determined through all of our assessments that political support for the ministry or agency is very important in the application process, because it helps to ensure that the resources are present for the agency to progress with their plans and their work to meet the PICS requirements. And that the legislation in the country or territory where the authority is inspecting is equivalent in terms of the GMP compliance program. All manufacturing facilities must comply with GMP requirements, and that calls for a licensing system of sorts and also recall mechanisms. There are PICS guidelines in place that help to build an inspectorate's quality system, and I'll speak a little bit later about those. And they should be implemented within the authority applying for membership. There should be records to demonstrate the inspector's qualification and their training, and procedures that define how they are achieved. There should also be funding available for participation in training and in meetings, and for the application itself. And also commitment from the personnel to respond to inquiries and information requested by the rapporteur. In this slide, I set out the differences between the two processes that I've just spoken about. So pre-accession versus membership. Remembering that pre-accession is a 2-year process, accession can take up to 6 years. We would say that pre-accession is a much softer process. It's there to help and assist agencies to become familiar with the PICS standard and requirements, to give them some idea of what it would be like to be part of PICS. A gap analysis is performed as part of the pre-accession process. The outcome from pre-accession is that an authority may be invited to apply for membership, or the gaps remedied, and if legislation is required, extra time may be needed by the authority to comply with what the PICS standard is across members. On the accession side, the timeline is quite different in that it's 6 years, but a rapporteur is also appointed by the PICS committee, and the rapporteur will carry out a detailed assessment of the paper application first. And once all of the issues have been answered and resolved, a delegation will plan an assessment in the country of the applicant to review their on-site activities and also to observe them inspecting. This results in a report being issued to the applicant and to the committee, and in that a conclusion will be explained about whether the applicant is considered to have equivalent systems of inspection and GMP standards to PICS members, and then the committee decide on membership. When we look to the benefits of applying to PICS and being part of PICS, we could describe them around this wheel here in general areas where you have reliance on GMP decisions taken by other PICS authorities. Then on the accession, which is the membership process, drives improvements. And we reassess members also, and that brings improvements also within inspectorates. There are cost-saving elements to being a member of PICS, especially for authorities that rely heavily on import testing. Cost savings can be brought about by relying instead on GMP information from PICS countries. In the same way, this facilitates the export and import of medicines. For me, I think one of the most important benefits is for an authority to have an involvement in developing international GMPs and to be involved in working groups that can influence the good manufacturing practice standards. Training, again, is another really important aspect for PICS, so that inspectors of all of the different member authorities follow harmonized processes and harmonized interpretation of the GMP standards. And this then leads into exchange of best practice between the working groups and expert circles that we've established. Inspectors benefit hugely from networking within PICS and from having contacts and access to inspectors in other authorities that they can reach out to get their views on how complex problems or issues are viewed or worked through in other geographical areas. So when we look at the accession-driven improvements, these are brought about largely through the process of an application to PICS and the development and implementation of the quality system within the inspectorate and records that support that. Within PICS, there is a reference document, PI 002 on third revision, that gives very detailed information on the quality system requirements. So if you like, it's a quality manual that inspectorates can use and build their quality system to reflect. And this is very helpful to allow authorities, member authorities, to meet the requirements of PICS. To speak a little bit about the PICS GMP guide, it's equivalent in many respects to the European Commission's GMP guide. There are some differences when we speak about qualified person versus authorized person. But it has the same structure in that it contains part 1 and part 2 plus annexes. The PICS guide is updated in tandem with the European guide. And there are now joint working groups between the European Medicines Agency, IWG, and PICS and the partner organizations to develop and update guidance at the same time. And this has been very welcomed and has really assisted PICS in influencing the way that GMPs evolve. And every member sitting at the table has a say in how the GMPs are adopted and how they are implemented. And this is a really important development and aspect for PICS. Okay. I mentioned training and exchange of practice, and I wanted to go back to what I mentioned earlier, the PICS Inspectorate Academy. Established in 2014, it promotes the development of inspection processes and using a lot of the training material that we have in PICS and putting that on a platform that's accessible to everybody. It allows us to calibrate our GMP knowledge and our skills, and also the expectations that we have of the industry. It will be developed as a formal education centre where defined training and qualification programs will be available and accreditation to those. The system is being developed to be able to respond to current and future training needs within authorities, and also to speed up the training for inspectors. There's very strong support from the heads of medicines agencies and from the PICS participating authorities and partner and professional associations for this platform and for this academy within PICS. And I think it's a very exciting development for us as an organisation. We have many expert circles within PICS that work to draft guidance documents and training in specialised areas. And I've mentioned some of them here. So we have an expert circle in active pharmaceutical ingredients, cross-contamination control and shared facilities, blood, tissues and cells and ATMPs, quality risk management, good distribution practice, computerized systems, and one final one that I don't have on the slide, a new expert circle on GCP and GVP, so good clinical practice and good vigilance practice. The expert circles generally meet on an annual basis, and they, a program committee, develop an agenda and invite speakers, and we would have approximately 100 inspectors join for 3 days training to discuss developments in areas that are relevant to the scope of the expert circle. Another important training initiative that we have in PICS is the joint visit program. So this allows a group of 3 inspectors from 3 different countries to come together and carry out 1 inspection, usually per year, in each country. And this allows for greater sharing of information about the standards and the training and the inspection process used by the host country. It also allows the inspectors to have conversations and discussions about GMP interpretation, and allows us to understand the inspection procedures that are used in other countries. And this all helps to build in terms of confidence between members so that we can rely on each other in this global setting. And then finally, some information here on this slide about the PICS Secretariat, a small team who operate in Geneva, Switzerland, and they are the first port of call for any authority interested in getting more information about PICS pre-accession or membership process. And they are there to answering any questions you have and to guide you by providing forms and further information about PICS. I've included here the website address for PICS, which is a really useful resource and somewhere where you can get a lot of information about the application process. And finally, just to say thank you all very much for listening today and for your interest in PICS. And I'm happy to answer any questions that have come through. Thank you.
Thank you very much, Anne, for that wonderful overview and detailed discussion on the many benefits resulting from active participation in PICS. So now it's my pleasure to introduce our next featured speaker, Dr. Joey Gauss, who will discuss the topic of reliance and the importance of establishing effective and strategic partnerships through recognition. Dr. Joey is the group lead of inspection services for the World Health Organization pre-qualification unit based in Geneva, Switzerland. She is responsible for the oversight of all inspections relating to medicines, vaccines, medical devices, and vector control products. Until December 2017, Dr. Joey headed the National Medicines Regulatory Authority of South Africa as the Registrar of Medicines and was appointed by the South African Minister of Health. She joined the South African Department of Health in 1993 and in 2002 was appointed as the head of Medicines Inspectorate within the Department of Health. Her duties related to GMP, GWP, GCP inspections, both domestic and international, and the licensing of medicine manufacturers and wholesalers. She was also responsible for overseeing compliance to the Medicines and Related Substances Act, Act 101 of 1965, which included importation, advertising, illegal and substandard medicines, and product complaints. As a pharmacist, Dr. Joey's working experience includes retail pharmacy, hospital pharmacy, and managing the Regulatory Affairs Department of the pharmaceutical company Bayer Limited in Johannesburg. Dr. Joey holds both a science degree and a pharmacy degree from the University of the Northwest, a Hans degree in pharmacology, a master degree and a PhD in pharmaceuticals, as well as an MBA from the Gibbs Business School, University of Pretoria in South Africa. Dr. Joey is a member of a number of international pharmaceutical associations and served as the PICS chairperson for the 2014 to 2015 term. So it is with great personal and professional pride and pleasure that I kindly ask you all to join me in welcoming Dr. Joey House to the virtual stage. Dr. Joey, you have the floor.
So thank you very much, everybody, and thanks for the invitation. And it's really a pleasure to be invited to this new platform that we all are trying to get accomplished with, and to be working and talking to the entire world from your office and from your desk. It's an interesting concept, and it's I think for everybody it's quite new. So thanks, Catherine, for the invitation. So can I please ask that we go to the opening and the content? Thank you very much. In terms of the content, I would like to talk a little bit about definitions, then look at where we are in the regulatory landscape, talk a little bit about, as a regulator, what has happened over time, talk a little bit about the WHO survey on reliance, which is extremely important, I think, from a perspective where we are today, how to implement smart regulation. And then I'm a little bit biased by talking about WHO and PICS role in reliance. Due to my long relationship with PICS, I would really support the good work that Anne and the team is doing in terms of PICS. And I would like to just give you my personal experience and guidance, how to actually get into this wonderful group and family of PICS.
Très important. Et ensuite, je voudrais donc donner un démon. Le prochain slide, par définition, je pense que tout le côté de législation, nous avons été impliqués dans l'ébauche pendant des les avocats disent toujours regardez les définitions pour commencer à travailler. Donc, je voudrais vraiment partager avec vous 3 définitions qui sont importantes pour nous. Donc, du point de vue le partenariat, de la défense et de la reconnaissance, des choses qui sont importantes pour le travail.
Where we work together, we cooperate, we collaborate, and we share. And then secondly, I'm sorry, just go back to, yes. And then secondly, when we look at reliance, specifically an activity that is based on trust between the different parties. And although we rely on trust, each one is actually using their own decision in the decision-making process. And lastly, when we look at recognition, where recognition would be just a routine acceptance of a specific decision of one of the countries or regulatory authorities that you actually rely on. So looking at the three definitions, I think we can play with them, and you can play around with them within your own regulatory authority and decide which would work best for you as a regulatory authority. Now, if we go to the next slide and we look at the development of the regulatory landscape over time, I think it's, again, it's quite important for us to look at where we have been over the years and where we are today in 2020. And I think when we start as regulators and when the regulatory systems in our countries were set up, it's important for us to acknowledge the processes and the work that has gone into the entire establishment of the regulatory landscape in each one of our countries. And look at a little bit where we are today in 2020 and how can we tap into all these best practices going forward in this new global environment where COVID is running wild and COVID is keeping us in our countries, and where COVID is directing us to start thinking smarter and working smarter. Next slide, please. So if we look at a regulator, where were we over time? And I mean, I would like to just use the South African example, where in 1965, when the regulatory system was set up in my own country, everything has had to do with legislation. So the entire environment in the country was about legislation, putting up new systems, putting up new specific laws. And within the regulatory landscape in South Africa at that stage in 1965, there were a lot of local production. There were a number of manufacturing facilities, and that we saw across the globe in all the countries where legislation was actually established. And 65 is actually a kind of benchmarking year, because across the globe, we actually saw that regulatory authorities were more or less starting to lift their heads in round about the 60s, early 70s, and legislation was implemented. Local production, everybody made medicines in the different countries. There were very few imports. There were a lot of manufacturing facilities, and the regulators had to really deal with these manufacturing activities. So most important, the regulators started evaluating, they started inspecting, they started registering products, and the regulators didn't know about one another. They sat in their own little corners. There was hardly any travel because it was too expensive to travel. There was hardly any knowledge about what was happening in other regulatory environments. The EMEA did not even exist in those days because they were only established in 1995. Although the FDA was already established back in 1906, it was just this big regulatory authority that everybody knew was the like the golden platform for regulators, but nobody actually know what happened at the FDA. We heard about the FDA on the news, but nobody visited the FDA because we just couldn't travel. And then in terms of WHO, although the WHO was established in 1948, it was not really established for medicines. It was established to look after the world in terms of health. So there was a lot of health directives and a lot of health guidance documents, but nothing to do with regulations in terms of medicines, in terms of devices, in terms of any of the other well-known products that we know today about. Nothing to do about vaccines, nothing. So the regulatory authorities knew a little bit, but it was very limited information. Can I go to the next slide, please? So just move on, please, to the next slide. Yes. So as regulator, how did we then progress over time? And we saw that science developed extensively. And once again, if we just step back and look at what is happening with COVID, I mean, each and every day we see a new paper being published in one of the journals on COVID. So science is developing extremely fast. We saw that there was a number of good regulatory practice guidelines developed. We saw that in 1975, the GMP guideline was first established, and there was write-ups on good manufacturing practices. And over time, we saw also the development of good clinical practice, good laboratory practice, and good pharmacovigilance practice. So all of that happened during the times of the initial establishment until today. And then slowly but surely, the regulatory authorities also became familiar with the big role players, because we could now start traveling. We could visit the FDA, we could visit WHO, we could even go to Australia to go and look at what is happening in Australia. We could come to Europe and talk to our counterparts in the European Medicines Agency, and we could start building trust, start building platforms, and start building knowledge about regulatory best practices. And then, of course, as Anne said and explained to us, in 1971, PICS was established, and suddenly there was a specific section or a specific organization that specifically looked at inspections. That was really a big breakthrough in terms of the regulatory platform. I would like to quote the FDA Commissioner, Dr. Scott Gottlieb, in 27, where it was already, he already acknowledged that it's much better to gain partnership and to look at the work that we need to do to minimize duplication of effort, and by partnering, we could actually tap into the experience of our colleagues, tap into the experience of more resources, and actually come up with a better system in our own regulatory environment. Next slide, please. So even at WHO, the World Health Assembly gave us a directive to start looking at what is happening in the world in terms of regulatory competency and the regulatory environment. And WHO then issued a questionnaire during the 2016-2017, where regulatory authorities were asked to actually rate themselves in terms of what systems they have available. And from the 194 member states that is part of the World Health Organization, there's still 100 countries that is regarded as maturity level 1. So maturity level 1 is a country that has very, very basic regulatory systems in place or no regulatory systems in place. We see that there are about 22% of countries that have maturity level 2, where there's at least some kind of regulatory systems in place, some kind of control in terms of importation of product. And then as of 16 July 2020, we can say with confidence that 52 countries of the world actually have reached maturity level 3 and maturity level 4, which relate to well-resourced regulatory authorities and well-matured regulatory authorities. So at the moment, if we step back and we look at what is happening globally, we see that actually there's only 27 of all the regulatory authorities that belong to WHO has actually a workable regulatory platform and to look after their public and to make sure that effective, quality and safe medicines are distributed in those countries. Please go to the next slide. Thank you. So if we then just reflect on the diagram that I've just shared with you, it's very eminent that regulatory authorities today are under mounting pressure to improve performance and to facilitate timely access to safe, effective and quality medicines. So the task is even becoming bigger, globalization, because we see that in the past, when in the 60s, when everything happened in our own countries, we actually now see that a lot is being outsourced because it became too expensive to run a manufacturing facility in a country. It's becoming too expensive to do clinical trials in a country. So we see that clinical trials are being conducted to this, which is have a huge population that can participate in those clinical studies. And those clinical studies are being presented to regulatory authorities across the globe. In our low and middle income countries, it's being presented. Products that has been manufactured in other countries are being presented in the low and middle income countries. Products are being assembled and packaged in other countries and not in our own countries. So it's becoming increasingly complex to actually have a finger on the pulse of what is happening with medicines across the globe and where our own regulatory authority in our own country can pronounce on products that is coming into the country. Of course, this challenge is actually much more acute in the low and middle income countries. Next slide, please. So if we then look at 2% of the countries that have strong maturity regulatory authorities and the rest that don't have any, those 100 countries that battle, we see that there is also, based on the information to our knowledge and to our disposal, there's a disparity in the health and the life expectation in those countries. And when we draw the line directly to the regulatory capacity, we see that there's also inadequate regulatory capacity in those countries, and there's also very little collaboration and work sharing in the medicine regulation environment. So the challenge is, what can we do about this? How can we assist? The challenge is that there's limited capacity in those countries to actually execute the core regulatory functions. And to try and assist, we are talking about building capacity. We are really preaching about collaboration, and we are really advocating reliances amongst the different regulatory authorities. Next slide, please. Just go to the next slide, please. Yes. So when we step back and we look at the latest information on inspection data, and I'm specifically looking at inspection data because our workshop of today is about PICS and about inspections. We see that the European Federation of Pharmaceutical Industries and Association that actually do a survey yearly on what is happening in terms of inspections. they had just published in May 2020 the 2019 information about inspections. And what they are telling us that globally there are much more reliance across the different inspectorates, because from the 284 inspections that had been done by foreign inspectorates, we see that there's a decrease in inspections being conducted in PICS member countries. We also see that there's greater recognition because of the MRAs that has been proving some benefit, specifically the EU and the US MRA that has been signed between the two parties. We also see that there are much more sharing of collaboration and much more joint inspections and pilots being done between the different regulatory authorities. And we also see that with Brexit, with COVID, and with the nitrosamine, there are much more reliances being promulgated, and there's much more reliance being advocated across the regulatory authority to come up with best practices for specifically the COVID legislative and registration process, and also the nitrosamine process of the APIs. Next slide, please. So as a regulator, how can we use then the best practices that is being presented across the globe? How can we take that and how can we become a much more modern regulator? And how can we use these best practices to better serve our people and be on the front line of the activities? And of course, when we look at the national level, we know that up to now we have put in place a legal framework, we have policies, we have human resources, but we need to move towards bigger collaboration and bigger work sharing. Next slide, please. So in support of the reliance concept, WHO then once again stepped up and decided, let's circulate a survey and just start looking at exactly who is relying on whom at this point in time. We are in October 2018, and which countries and which regulators are relying on one another. And go to the next slide, please. And to our astonishment, it was very clear that it's no longer a question of, are we going to rely? It's just a matter of how quickly can we start relying on one another? Because the reliance occurred amongst all the regulatory agencies, from the FDA, which is regarded normally as the most resourced agency, through to the most less resourced agency that is playing in the regulatory landscape. So everybody is relying on one another because it became impossible for regulatory authorities to do all the work themselves, to make sure that they run across the globe, do inspections in all the countries, evaluate all the dossiers. So at some stage, I think the outcome of this survey was not a surprise. It was just confirming what WHO was seeing in the regulatory landscape, that everybody is starting to rely on one another. Now, if we are a regulatory authority that really wants to support our people in our country, what can we do and how can this happen? Unfortunately, it doesn't happen by magic. It really requires a lot of thinking. It really requires a lot of international strategy. It requires a framework. It requires planning. It requires hard work, resources, and most of all, it requires industry buy-in. No regulatory authority can start working on reliance if we don't have the industry buy-in in the entire process. Because industry must also up their game if the regulatory authority is upping their game. So it's extremely important then when the regulatory authority decides to start looking into reliance, to bring along the industry and get their buy-in in the entire process. Now, of course, where can you knock? And because this is a specific workshop on WHO and PICS, please come to WHO, please go to PICS, and please start investigating and working together with the two authorities or organizations to move towards reliance. Next slide, please. So as a smart regulator, I mentioned that you need to make very hard decisions to become a smart regulator, to move from the normal standard processes where everything was done by your own agency, but move towards more reliance, move towards PICS in a unilateral recognition process. Remember what Anne again said, it's not necessary for the regulatory authority to sign up for mutual recognition. You as the regulatory authority in your country can decide that you will unilateral accept the PICS information and the PICS inspection reports. Next slide, please. So if we start looking at the NRA registration pathways, can I please ask that you just click through the entire slide, because there's lots of information. Yes, that's it. Thank you. Oops, just go back. Yeah, there you are. So when we start looking at the NRA registration pathways, we see that there's different levels of effort. And that's why I mentioned to you, it's quite an experience. It's quite an effort. It's a lot of work to actually move up in the registration pathway steps. So first of all, the most important one is to start to recognize what is happening around you. And through recognition, as a regulatory authority, you can just grab the information that is available from national regulatory authorities that you recognize, from PICS members, participating authorities, from WHO pre-qualification, from EU, if you recognize the EU mutual recognition process, you can just acknowledge and accept those information. The second step will then, of course, be, no, go back, please. Yes. The second step will then, of course, be reliance, where when we look at reliance, there is a little bit of more effort from the agency, where the agency will start looking at primary reports from other agency, look at them, evaluate those, and make an informed decision on the reports that is available. Now, Africa had moved quite extensively ahead in work sharing, and Zazibona is one of the, I would really say, one of the flags of Africa, where there's a lot of work sharing already, and that's the third process that you can start looking at. And then, of course, we move into joint activities, where we start sharing inspections, we start performing inspections together, and that again is also what PICS stands for, and what Anne was telling us about the joint inspections, learning from one another, even the assessment process, and then of course eventually full assessment if we have the resources and if we have the capabilities. Next slide, please. So if we, just the next slide.
Dr. Joey will be finishing up in a minute, so there are many more slides that we will be sharing from her slide deck, but she will run through them now very quickly as she finishes.
Thank you very much. So if we go to the next slide, we see the most important part is reliance, recognition, and partnership. And all of those is built on trust. So next slide, please. So where can we start? The slide as well. So again, where can we start and what can we do? And it's very important and it's very eminent that we look at the WHO collaboration procedure. We look at the collaborative procedure for stringent regulatory authorities where PICS tap into, and then we look at the regional networks that we see quite extensively within Africa. Next slide, please. So for us to start then as a regulatory authority, the easiest way is to start with regulatory inspections and start building within your authority your regulatory inspection process, and that then links directly into the PICS activities. Next slide, please. If you do not want to start with PICS or the inspection processes, start looking at Reliance for assessment, the entire assessment process. And if you then decide to go onto the assessment process, look at which agency you're going to rely with and make sure that they have a long-standing reputation in the international community. Next slide. So when we step back a little bit and we look at today's journey on how WHO can help and how PICS can help in making sure that regulatory authorities adhere to smart regulations and support their countries and support their people, we see that there are two different roles between WHO and PICS. PICS is open for inspections. WHO's role is specifically only open for assessment of products that belong under the WHO umbrella, and that is for HIV, TB, and malaria. PICS role is open for inspectorates across the entire globe. So again, we see that there are norms and standards developed between WHO and PICS. What is important is that these norms and standards from a WHO perspective is a little bit more expansive and contains much more information about and try to be much more clear than the PICS guideline documents. We see also then that the WHO role talks about capacity building and joint work, which is also the case for PICS. And if we look at the PICS role in terms of joint visit inspections, we also see the WHO support that. When we go to the final message that I would like to leave you today with is that there's strong and efficient regulatory systems is required for reliance, for work sharing, and for international collaboration. And the tools are there to actually develop your regulatory system in your own country. You just need to tap into that. Most important, there must be political will, and there must be regulatory will, and there must be industry will. Next slide, please. So in closure, regulatory systems should be science-based. We need to adopt an approach to focus on what we cannot be doing in our outside of our country, and leave that and leverage on the work of other trusted regulators and institutions, and focus on what we can do in our own country. Now, one of my colleagues at WHO always likes to use, I think it's a beautiful slide. It mentions one of the African proverbs where it's saying, if you cannot go quickly, If you want to go quickly, you need to go alone. But if you want to go further, you need to hold hands with somebody else and go together. So that in closing, I would like to thank you very much for the opportunity to talk to my colleagues in Africa. Thank you.
Thank you very much, Dr. Joey, for that fantastic and comprehensive presentation. Again, all of the speakers' presentations will be made available in PDF version, and the recorded version of today's event will also be available to you as registered attendees. So now we're going to skip over to our next featured speaker, Dr. Lois Kikwai. She is the Regulatory Director for the Africa-wide PICS Initiative, and she will provide an introduction and overview of the AwPI program. So Dr. Lois, you have the floor.
Thank you, Catherine, for the kind introduction. It is an honor to be speaking to such a distinguished audience. My presentation today will be introduction and overview of the Africa-wide PICS initiative. And hopefully by the end of the presentation, I'll be able to answer the question, who are we? What do we plan to do? How do we plan to do it? And what is next? In this slide, you can see the composition of the AwPI team. And it's my pleasure to introduce the three partners that came together to form AwPI: Oaks Group Global, Bloom Public Health, and LCK Pharmaceutical Consulting. The three organizations have extensive experience in all aspects of the pharmaceutical sector and are ready to hit the ground running with actionable, sustainable plans to inform pharma to transform the pharmaceutical sector in Africa. On the left side of the slide, you can see the leadership team, and they'll be responsible for the strategic planning, technical direction, and execution of the AwPI goals. On the bottom right, you'll see the project team, which will be handling the programmatic and operational aspects of AwPI. The AwPI team is a well-equipped team that is ready to engage with regulators, educators, industry, and other resource partners to ensure that the project is successful. Our first step is to engage with you regulators. Since you are the policymakers, the sector will not be able to change unless transformation begins with and is championed and in partnership with you. As we are also happy to continue working together with others on the continent to provide additional momentum and help to accelerate what is already happening in the pharma sector in the various countries. At the same time, we plan to leverage WHO's efforts and value that it brings to the continent, a lot of which has already been highlighted by Dr. Joey Gauss. What do we plan to do? The first goal of AwPI is to engage MRAs by increasing the presence and participation in the PICS scheme. In this effort, we will be able to explain benefits and requirements of PICS membership, at the same time provide a well-tailored approach and the necessary support to achieve a successful accession into the PICS membership. Participating in PICS with your regulatory peers will result in a marked improvement in all regulatory areas that are governed by GMPs. AwPI will facilitate all aspects of the process by engaging with regulators, eventually engaging with industry, educators, and contributing to the overall change in the pharmaceutical sector. So in the process, when we engage with regulators, we hope there'll be an updating of GMP policies in registration, licensing, inspections and enforcement, and the national laboratories. Once we have the MRAs well on their way to participating in PICS, we will start to see a trickle-down effect from the benefits of improved GMP policies. At a point prior to implementation of these regulatory changes, AwPI will facilitate dialogue between the pharma industry and the MRAs to assess their ability to meet the new policies. This dialogue will include discussions on how to maximize the current facilities potential by ramping up capacity building of training on the current staff and evaluating the need for upgrading the infrastructure as needed. In that way, we find that in the industry area, there'll be improved of GMP policies and enhanced the quality and capacity of the manufacturing that's happening in the industry. AwPI will ensure that the industry receives actionable interventions and connect them with the right resource partner so as to meet the regulatory requirements. At the same time, there'll be a negotiation of a timeline or transition period between the MRA and industry, therefore ensuring no company is left behind, and thus minimizing the risk of crippling the pharmaceutical industry capacity that we currently have. So in that manner, we will also be engaging in efforts to populate the industry with well-qualified professional. This will require a dialogue between regulators, academia, industry, therefore pushing for personnel with the right qualifications during onboarding. This will ensure that the right people are working at the right jobs. That means there might be a requirement to revisit some of the curriculums to meet the needs of the pharmaceutical sector as it's transforming. That means AwPI process, as it engages with educators, will help to build capacity within the companies right now by retraining at centers of excellence, and also improve curriculum in academic institution to ensure the right pharmaceutical employees. As you can see, the impact of participating in PICS will mend and help transform a fragmented pharmaceutical sector by affecting the regulatory processes, the pharmaceutical industry processes, and the educational and academic processes. So what is next for AwPI and our engagement with you? AwPI will send out a post-webinar survey to confirm the level of interest or your participation in PICS. In this way, we will ensure that you are getting the right service for the type of engagement you want to participate in with PICS. AwPI will also coordinate with MRA personnel to ensure that we have an updated contact list and make sure that we have the right personnel that we'll be engaging with in the implementation of this project. AwPI will also be hosting future webinars to address various aspects of the initiative specific to the MRA interests. For example, what do you get as an invited guest, the pre-accession process, the accession process, and other things that will pertain to the post-accession process when you've attained membership. Remember that this initiative is going to be a long-term investment that will require a paradigm shift from the way we were doing business in the past and to ensure a sustainable project. This multi-year project will require commitment from the regulators, from the industry, and also from academia. This project can be a country-by-country project, or we can leverage the power of regional economic blocks and mutual recognition that already exist on the continent by leaning on the concepts that have already been discussed by Dr. Joey Gauss. With the right tools, we can maximize the benefits of PICS and eventually propel our pharmaceutical sector to the global arena. The right partners and the right time. When embarking on a project of this magnitude, one needs to have the right partner and must execute at the right time. COVID pandemic has brought to the forefront the need for Africa to start transforming its pharmaceutical sector by taking control and securing the medicine supply chain. So Africa, the time is now. I hope we can take advantage of PICS and the benefits that it brings as we move forward in this new era of pharmaceutical development. Thank you very much.
Thank you, Dr. Lois. I'm sorry that time was a little bit short. At least all of the attendees here can understand the purpose and the mission of AwPI. So thank you very much. And now I would like to invite Professor Chimezi. So it's my pleasure to introduce Professor Chimezi Anyakora. He is the Program Director of AwPI and the CEO of Bloom Public Health. Professor Chimezi will discuss the programmatic aspects of the Africa-wide PICS initiative. Professor Chimezi, you have the floor.
Thank you so much, Catherine. Thank you so much, everyone, for coming. I think this is quite an exciting time for me and for Africa. I want to start with this quote. Each time I have to talk, I always start with this, because for me, it's quite exciting. It summarizes everything we're doing now. It says, in the future, regional and global power and national stability will be determined not by who controls arms, but by who controls access to medicines. Why is this important, especially for this audience? We are dealing with regulators here. For many years, for decades, Africa has been on the receiving side of medicines. Nothing is happening. I see this initiative as an opportunity to change the narrative. Next slide, please. Next slide. Next slide. Okay, good. So I see this as we need to change the narrative. If you look at this slide, you see that for the past 20 years, we've had so many interventions across the world: WHO pre-qualification, Global Fund, PEPFAR, UNITAID, and so on. All these have been made to support medicine availability in Africa. One thing that keeps striking me, or personally as an African, why is it that after 18 years of Global Fund program, Africa is yet to participate? The answer is our regulators are not moving. We need to do much more. For example, in Nigeria, in January, we're going to receive $900 million to support malaria, HIV, and tuberculosis. Most of this will be spent on medicines. Not even one will be procured from Nigeria. So this is something, a challenge for all of us. So for this slide, I want us to look at it from a point of view of this year, AwPI becomes one more landmark in this series of events. If we as regulators come together and see how do we change the narrative, this PICS opportunity is something that can help us change things, really. But if you see PICS ascension as something that will open up access to medicine and make Africans participate much more. After so many years of PICS existence, we still have only one country in Africa participating. This partnership is here to help all of us, to give all the support we need to make sure that the continent has many more countries in PICS. Next slide, please. Now, at a glance, I want to look at African farmer. Right now, or rather by the end of this year, we expect to have at least $60 million as the market size. And with the African Continental Free Trade Zone, Free Trade Agreement, it will increase. This is an opportunity for us to see what do we do, how do we participate, what can happen. And my message is simple. We regulators are the drivers of this. Regulators can play a very important role. Also, another thing we can see is the importation, how the pharma sector is in Africa. 95% of APIs are imported. 70% of finished products are imported. Of course, many other things really, like the capacity for regulatory functions, I mean, you could say it's still limited. and there's much more need for harmonization. Of course, as we see over these years, I mean, I've been part of the system for quite a while, and what stands out clearly is that there's a limited specialized pharmaceutical skills, really, something that we have seriously. And of course, the ecosystem to support the pharmaceutical sector is still lacking. Next slide. With all this background, because I want to make my own very short, with all this background, where do we go from here? First of all, there's a need for paradigm shifts. That is why AwPI is here to support. I want to summarize this project in 2 words, basically. Country ownership. For more than a decade, I've been very much involved in supporting the pharmaceutical sector in the continent. One thing stands out. Most countries wait for people to bring projects and programs and support them, and they're just a passive participant in the whole process. AwPI promise is different. We want to change the narrative. For this project, we are hoping that each country takes a strong ownership. In partnership with other efforts across the continent, AwPI is here to support countries who are taking ownership. For that purpose, we're going to have 2 funding mechanisms for this project, because it has to be funded to make it happen. First is that we want each country to, first of all, see how they can fund this project. As right now, many countries are writing their Global Fund grants. This is the time we can actually participate and request for PICS Ascension to be included in our grants. If you need any support, we can provide that support, but we want to make sure that this project stands out as being a project that has the strongest country ownership. Another option we have for funding as AwPI team, we are trying to get a continental funding to support countries that need it. But a preferred option, in line with our attitude or thinking, that country ownership which makes this work. This is a long-term, as Dr. Lloyd said, a long-term project. It's not something that is ad hoc. It requires a country to decide this is what we want to do, and this is why I want to do it. Our commitment at API is at AwPI. We are fully committed to support this to the end. The commitment of the partners is amazing. Really, over these years, I've not seen this kind of commitment. So our commitment is simple, that we're here to partner with you throughout the process. Next slide. So I conclude, simple. I mean, most people in this project who have been involved in project design, project execution, and closeouts. After this experience, we're coming out with something different. Beyond the commitment of being Africans leading these projects with some kind of patriotic undertone, we think that it's going to be a different thing. We're going to learn a lot from our experience over these years, over these decades, to bring something different. We're going to leverage the existing efforts and act as catalysts of transformation of the pharmaceutical sector. We're not seeing this as just one more activity. AwPI supporting PICS projects in Africa. We want it to be written in gold in history at this point in time, that in 2020, a few organizations came together and we got the commitment of countries to change the narratives. Thank you.
Thank you very much, Professor, for that brief overview of AwPI and the programmatic aspects of the project. So again, I thank all of the attendees. And as Professor said, we need country ownership. And I'm proud to announce that there's more than 25 individual countries represented here today in attendance. So I ask you, please, we have a few more minutes for our final speaker. If you could please stay on, because it's very important. Our final speaker, Dr. Patrick Lucollet, who is the AwPI Steering Committee Chair and Advisory Board member of Bloom Public Health, will discuss the very important benefits of the Africa-wide PICS initiative to the pharmaceutical industry across the African continent. So I do realize we're a few minutes over time, but it would be well worth your while to stay around to hear Professor Lukulai's presentation. Thank you very much. Professor, you have the floor. I'm sorry, Dr. Patrick, you have the floor.
So thanks a lot, Catherine. This is really an honor for me to be tapped to contribute to the success of this initiative. As an African, I can say that the excitement is huge because I can see how different this is going to be in terms of accelerating the pace of the development of our regulatory authorities and all the benefits that come for the pharmaceutical industry. So my simple message, just to start introducing my slides, is how is this initiative going to be any different from the numerous initiatives that we've had in building capacity? And the answer to that is this is going to build on those. This initiative is not negating any of all the efforts that have been made by other development partners. Some of those activities, some of us have been involved in deeply, such as the support from the World Health Organization, support from other development partners, USAID, African Union, NEPAD, etc. What we are attempting to do here is to accelerate the pace at which our regulators are going to improve systems and therefore benefit the African pharma companies. So to understand the benefits of what AwPI is going to bring to the landscape, we have to look at what the current status quo is. I would be the first to submit that there's been a lot of progress in terms of drug regulation on the continent. A few years ago, we did not have countries with very good legal framework. Today we do. Today we have a number of countries that are level 3 on the World Health Organization global benchmarking tool. We have countries that have made tremendous strides. The message that remains to still be inculcated or to be promoted is what do we show for all the improvements that have been made by the African regulatory authorities. The promise of AwPI is to put the African regulators on the map, put you in this club, if I could use that word, and all the benefits of being part of the PICS membership. It is one thing to undergo endless capacity building activities. It is another thing to show your progress and maturity towards those competencies that you have built and created. So the promise of AwPI is to really show the progress African regulators have made and to put you in this special club where you would now participate fully in the whole concept of reliance, participate fully in the concept of joint reviews or sharing best practices together as full-fledged members of the international community. So let us look at just few of the where we are in the status quo of things. Go back, please. I'll be very brief with this. The point I want to make about this slide is that there is no shortage of standards in Africa. What we have is shortage of enforcement will. As a result of this shortage of enforcement and poor enforcement, we are creating an unequal level playing field. You have companies that are doing the best to comply with standards and those that are not, but yet they all compete for the same market. This is an unfair situation. And what this also does is that it reduces it disincentivizes companies that want to do the right thing because there is no reward for doing the right thing. If we are all under the same jurisdiction and yet others are allowed to play below standards compared to those that want to play at standards, then you are not going to have a situation where you incentivize companies to want to improve the standards. This is why it's so important that we don't only focus on what those standards are, but we actually do the best we can to start enforcing the standards to create an environment where others will look at the regulatory system and say, yes, we give them high marks, we can accept the decisions that they make. AwPI is going to allow us to go into that arena wherein your regulatory decisions can be accepted because you have higher performance standards that have been vetted by others, and so you are considered part of the club and you are now able to derive all the benefits of being part of that club. Next slide, please. Okay, so what would the future look like with AwPI? What this future is going to look like is exciting for us because it's going to allow MRAs to achieve a status wherein they can be recognized for all the efforts in upgrading their quality management systems, all the trainings that you have been undertaking from various institutions. Those trainings are going to come to a head where you'll be recognized for the maturity level that you have achieved. So no longer just an endless training for regulatory bodies, but every improvement that is made is now getting you closer to becoming part of a group of regulators where your voice is respected and where you can be recognized for the contributions that you bring. With PICS membership, of course, there are also collateral benefits to the pharmaceutical companies because the inspection results of those local institutions that are PICS members are immediately recognized by procurement agencies. They are recognized by other more developed regulatory bodies, so that an inspection that has been conducted by a PICS member, if it's in your local, your country, may not have to be repeated by another inspection. And so it creates this opportunity for bigger patronage, where you're able to sell your products perhaps boundaries of your national, your countries, and can actually tap into some of the resources out there that seek to procure medicines for various public health programs. Dr. Chimezi mentioned $900 million for Nigeria. None of those monies is going to local companies in Nigeria because the regulatory institution is not deemed as part of an elite group, wherein their inspection results are honored by others. With AwPI, we're going to put our regulators on the map because their performance standards will go up and they'll be recognized for the improvements that they have made and thereby bring benefits to the industries that they regulate. Next slide, please. And so in conclusion, this is really going to usher in a new era for the transformation of the African pharma sector, and it's going to add on to other initiatives that are already going on the continent, but really help to accelerate the pace of those initiatives. Improved enforcement will raise industry standards. You will be African companies will be recognized because they are now under the jurisdiction of a PICS member regulator whose regulatory decisions are respected by others. MRA decisions will be accepted by other regulatory bodies, not just within Africa, but outside of Africa. And as I indicated, ultimately, this means revenue for African pharma companies because their quality management systems improvements are actually giving high marks, and others who deem it necessary to patronize them and buy their products because they are under the jurisdiction of highly valued PICS member regulatory bodies. So in conclusion, I will say that this is an exciting time. I hope that our regulators will see the benefit of actually accelerating their pace to become part of this PICS club, if I can call it that way. Annie called it a PICS family, where your regulatory decisions are actually respected by others, and the progress that you've made actually goes a long way for others to recognize all the good work and the quality improvements that you have made for the agencies and for your respective countries. So I'll stop here and look forward to further discussion. Thank you very much.
Thank you very much, Dr. Patrick, for that very informative presentation. And again, we were expecting to have a panel discussion. We've only had 5 or 6 questions coming from the attendees. So as we are out of time, I will tell you that again, these will be transcribed completely with their answers, and these will be made available to all registered attendees after the webinar. We did have most of the questions answered live by Ann Hayes when the questions were directed towards PICS. I do thank all of you for the positive comments that we did receive about the valuable presentations. So again, this is just the first step for all of us today. So on your PICS journey, whether you decide to be an invited guest or would like to have a pre-accession assessment or think you are ready for an accession application with the very first step. And today was that first step. I would like to recognize a very special guest among the audience. It's my dear esteemed colleague, Dr. Mohammed Alagil. And he has great experience as a new member who is going through the accession process. So again, there's many people out there in the regulatory framework to support you, whether it's WHO, the PICS Secretariat in Geneva directly, AwPI, or your fellow regulatory authorities. The very first event that is open to you as a non-member is coming up in September. It is going to be a virtual format. It will be the Turkish authority, Turkish Medicines and Medical Device Agency, hosting a one-day training workshop, which also is available to you as non-members on quality risk management. The next event that you are eligible for will be in December. It's a two-day workshop by the Finland authority that will cover remote assessment and remote inspections. So again, there are many opportunities and many benefits for all of you to take advantage of. And we at AwPI are here to help and support you in taking advantage of those benefits. So again, I will ask Professor Chemezi, Dr. Patrick, and Dr. Kikwai if they have any closing comments. And join me in thanking Ms. Ann Hayes and Dr. Joey Kraus for their wonderful presentations.
Thank you, everyone, again. I think the message is clear that AwPI is here to support. We're going to handhold all the whatever you require from us. We're going to count on our experience of doing this before, but learning from those experiences to support you and whatever way we can, we're really available to help. Also want to thank Ann Hayes and Joey for being here. This is a lot of a boost our morale that this is going to really happen. So thank you everyone for coming, and then we are here to support you. It's going to be a long journey, and we are here with you all the way. Thank you.
I would just like to support and second what Chimeze has said. We are your trusted partners. We are here to support you along the journey. We thank Ms. Ann Hayes and Dr. Joey Gauss for their participation and all the information that they've provided to this webinar. We look forward to working with you, and be rest assured, we are the ones who will be working with you on the ground. Thank you.
Thank you.
So finally, I would add my voice to my fellow panelists. I am very grateful for the opportunity here to serve as a steering committee chairman for this initiative. I know that African regulators are going to rise to the occasion. We've already seen tremendous progress that has been made in terms of improving regulatory systems on the continent. I can't wait to see those advanced regulators on the continent take this up and really show that they can be part of this club and start deriving all the benefits of being part of this club. AwPI is here to open the door for you. We will be facilitating this and will catalyze your participation towards the membership of PICS. So you can count on that, on us for that. Thank you very much.
So please, to all of the attendees, you can still submit your questions. So right now I see a few more questions coming in. We will be answering all questions. And in our final closing minutes, I would kindly ask Ann and Dr. Joey to please unmute so that you can say goodbye and any few words you'd like to leave us with.
From my side, I really want to commend you for your interest and for the courage to look at this and take it forward. I think it would be fantastic to see more African authorities within PICS, as the constant reliance on each other is so important and will continue to be as our commercial realities result in more globalized supply chains. So I think it's really encouraging to see that regulatory authorities are building their capacity and looking to harmonize and develop in their international capacities as well. And we're here to support you on that journey. Thank you very much.
Thank you very much, Anne, for those kind words. And again, the PIC Secretariat in Geneva is going to be flooded in the upcoming weeks with official requests from non-members to be invited guests. So we are ready to provide you with the template and teach you exactly what to do in order to take advantage of those opportunities. So again, thank you very much, Anne. And now we ask Joey for her closing remarks.
Thank you very much for once again the opportunity to talk to everybody, to talk to my colleagues in Africa. I really miss all of you. And my message, I want to leave you with one message, that if one country in Africa can become a PICS member, and that was 13 years ago, there's more than that one country that can become a PICS member. So I'm sure there are a lot of expertise by now, there are a lot of goodwill, there are a lot of energy, there are a lot of initiatives. So put that all in a basket and apply for PICS membership so that we can give Anne a little bit of work. Thank you very much and go well.
So it's really incredible to see all of the attendees are still on board. Nobody has left. So this is really amazing. And again, from all of the panelists, from AwPI, from PICS Geneva, the Secretariat, from the PICS chairperson, and from Dr. Joey Gauss from WHO, Africa, the time is now, and it's up to you. Thank you all very much. You will be receiving the information in the next coming days. You will have the recorded version and the transcripts, as well as the PDF slide decks. We look forward to working with you all. Thank you very much and have a nice day.